Intravenous iron is indicated where there is biochemical evidence of iron deficiency and oral iron is either inappropriate or ineffective. Further support on the interpretation of iron deficiency can be found in the medical guidelines under Investigation and Management of Iron Deficiency. The majority of patients at UHNM will receive Monifer. There is, however, a small cohort who will require Ferinject or Venofer depending on clinical situation. For your iron support documents, choose the Blood and Blood Products webpage. Select Iron Support Services and then the Monifer prescription chart. This should be printed and completed with the patient's details and the prescriber's details. You then need to work your way through the checklist, signing to confirm that each point has been undertaken. Obtain verbal consent for IV iron and document this in the medical notes. Further support on the consent are found in the medical guidelines. The Monifer prescription highlights the contraindications and cautions for IV iron. Where a patient has a caution, the iron should be given more slowly. You need to record the patient's current weight and their height so you can calculate the dosing weight. If a patient is at risk of micronutrient deficiency, then use their ideal body weight to dose according to sex unless their weight is lower. If the patient has a BMI above 30, you need to cap their dosing weight. Use the table at the right-hand bottom of the prescription chart to see if their weight exceeds a BMI of 30. This is your maximum dosing weight. For all other patients, use the actual body weight to dose. On page 2 of the Monifer prescription, enter your calculated dosing weight and the patient's haemoglobin concentration. Enter your prescriber details in full, legibly in the grey boxes on the left. Use the dosing weight and the haemoglobin concentration to calculate the required dose of Monifer and the rate. Enter the dose, rate and your signature in the grey prescription boxes below. This prescription is then sent to pharmacy for the medication and used by the nursing staff for administration. It should then be scanned and uploaded to iPortal. Further advice on iron can be found on the Blood and Blood Products webpage.